Hi everyone, I'm here with Dr. Bansal from Dallas in the Fort Worth area, and she services patients in Texas in those two areas. And there is so much need there. We get so many calls. And just so that you know, Geriatric House Call Dentistry is a group of independent doctors. Dr. Bansal has her own practice. She doesn't work for us.
Yes.
She's been practicing for many years. She trained in India, came back, went to Denver, did dental school there again.
And
a lifetime of dentistry. And she is here to serve the elderly homebound patients in your area. So she's so knowledgeable. She has her own practice. And today we're going to talk about patients with dementia or Alzheimer's disease, those that can't cooperate. You're watching this because you're wondering, how the heck is Dr. Bansal going to treat my mother or father when I took her to the dentist and all they did, my mother, my father, was scream. And the dentist said, I can't treat her. I'm sorry, I don't even know what to tell you to do. Maybe there's a disability clinic in the area. There probably isn't. There's very few in the country. So how do you treat these patients who are probably trying to bite your finger off? What do you do?
So usually empathy is a very important tool when you treat these patients. And then we have this bite stick, and it's a very, very convenient kind of an instrument. You put it in the patient mouth this way and then try to rotate it that way so that they can open, and when they bite on these two, you can see a lot of their teeth and what is going on, and then you switch to the other side the same way.
So this stick is made of foam. This is our wonderful little secret. And then there's also an 800 number, so you can purchase them for your caregivers so that they can brush the teeth. No more excuses that they're afraid of getting bitten because you cannot bite using that bite stick. So that's one thing. How about when we have to drill and fill on these dementia patients? It's impossible. What do you do?
So usually there's a very important medicament that is available. It's called SDF, silver diamine fluoride. And a drop of it will stop the cavity right there and then and can take the patient out of pain. So usually we call it no drill cavity filling, and the only side effect is it stains a little bit darker the tooth, but the important thing is the patient is out of pain. The patient is not hurting, and the family is happy. You're happy.
Exactly. So no more pain, no more cavity. It's arrested, which is why we like to use the actual brand Arrest by Elevate Oral Care, because it is the first, and everyone else copied them. And this is an FDA approved method. Since 2014, the FDA approved it as a class 2 medical device, but it's been used in Japan for over 80 years. So, you know.
In developed countries, that is the only way. There is no dental access, and it's an easier way where you can treat mass population and keep them out of pain.
So you used it in India?
Mm-hmm.
Oh wow, so this is nothing new. It is sort of new, you've never heard of it. And your dentist, if you ask your dentist about it, they may not have heard of it as well. And not everyone wants to have a stained black tooth, but it's better than pain or infection or the decay getting worse, where they'll need a root canal or an extraction. So even in the front of the mouth, for some of these dementia Alzheimer's patients, it's better than no treatment, which could lead to much worse things.
Oh, absolutely.
So we can treat dementia and Alzheimer's patients. We could use the bite stick. We could extract a tooth with the bite stick. We make them numb. We have very, very kind methods of injecting. And we got our stuff together, right?
We do.
We're a great group, and now we have Dallas. So welcome Dallas, and call Dr. Bansal at 866-686-4423. We look forward to hearing from you.
We look forward to hearing. Call back.